Good morning. It's a real pleasure to be here. These are my colleagues on the research team, and I want to give special thanks to the study participants and the National Institutes of Health. We did our study in Malawi, specifically in the rural Kasungu district that is in central Malawi. Malawi has one of the heaviest HIV burdens in the world and is among the poorest nations. 74% of its population live in extreme poverty. 84% are rural smallholder farmers. While poverty, food insecurity, and gender disparity are recognized as structural determinants of HIV/AIDS, few researchers have rigorously investigated if and how structural development programs may be changing the dynamics of HIV vulnerability. Our NGO academic partnership enabled us to do a detailed, controlled study of a real-world structural intervention by leveraging our strengths. The purpose of the SAGE4Health study was to evaluate a large-scale economic development program implemented by CARE Malawi to examine mechanisms and magnitude of impact on economic livelihoods, food security, and health. And our specific aim for this report is to examine how socioeconomic changes may affect the vulnerability to HIV and other risks that can overwhelm rural households in subsistence environments. This is what our project looked like. The program we evaluated was called SAFE. 9,000 households were educated in farmer field schools. 443 village savings and loans were formed. HIV and gender were mainstreamed, and so was capacity building for local governance. Using a quasi-experimental, non-equivalent control group, longitudinal design, we recruited 600 safe participant households and 300 control households. Data were collected 3 times over 3 years. We also did an end of program evaluation with 90 households drawn from that larger intervention group. We conducted 9 focus groups and 90 in-depth interviews. And this shows the timeline of data collection in relation to the intervention. We started with thematic analysis of the qualitative data to try to understand what participants' points of view were on the impact of the intervention. And then we analyzed our prospective survey data, focusing on outcome variables that corresponded to our qualitative findings. From farmer field schools, participants learned seed saving, community seed banking, crop diversification, more effective ridging, planting and fertilizing, and improved storage of harvested crops. Incremental agricultural successes increased food stores and buffered against economic crises. When adverse circumstances occurred, participants were less likely to turn to what they call ganyu, which is day labor in other people's fields. By limiting the amount of ganyu that they did, they were better able to manage their own farms. The Village and Saving and Loan also offered protection from economic shocks and gave households other alternatives when adverse events occurred, other than doing ganyu. There are emergency loans when, as one participant said, problems that fall suddenly on your household. Participants make monthly financial contributions and thus saved money safely for the first time in their lives. Loans were available to start small business like selling vegetables, which generated small amounts of cash. And year-end dividends were timed to the growing season, so they were able to buy fertilizer and seed and replenish diminishing storage of food for the hunger months, which are those before harvest. The investments, interest, and improvements stayed in the village, and participants liked what they called keeping our money here to enable ourselves. Perhaps most importantly, they had access to dignified and efficient means to obtain vitally necessary funds. Quote, "You do not have to wait, be humiliated, or be accused of complaining. Why? Because you are merely borrowing from what you are already saving." So this is to sum up the qualitative findings. These qualitative findings suggest that the SAFE intervention gave participants a good foundation of successful growing season, access to timely and efficient loans, and cumulative savings, so it enhanced their capacity to cope with sudden adversities like illness, hospitalization, and drought, without falling further into poverty. And an important change that it made in their lives, which they attributed to the intervention, was a decreased reliance on ganyu in times of hardship. What is at stake when a member of the household does ganyu? Referring to the cycle represented on the right, if economic shock leads to ganyu, that means household adults and or children cannot work in their own farms properly. They harvest less food for the family to eat in the coming year, leaving the households even more vulnerable to dire consequences from further future economic shocks. What they said was, ganyu takes you backwards. You leave your own garden. By the time you get back to it, things have gone bad. The crops you sowed are taken over by weeds. Ganyu was viewed essentially as the least desirable livelihood option. It was a double-edged sword. It might have met immediate needs, quote, "You work hard at ganyu so your children do not die of hunger." But simultaneously, it contributed to food insecurity and economic ruin. Quote, "If there is one way of finding money, it is ganyu. But if there is one way that also leads to poverty in the home, it is ganyu." Participants described ganyu as oppressive and health-threatening. They said things like, "Doing ganyu, you find your humanity is oppressed. It's compromised because people abuse you. Ganyu ruins our strength. It is heavy work beyond our capacity. We work beyond time that is reasonable." And with no worker protections, they could not even count on being paid. Someone said, "Ganyu is slavery. It cannot give you a future." Our quantitative findings then, we examined outcome variables corresponding to these findings that I've just described, and they were economic crises due to unpredictable events like illness and drought, and emergency livelihood strategies. In particular, whether household adults or children did ganyu to cope with food shortages. This and the following four figures will show you what our quantitative findings look like. Health shocks, as you can see, were very high for all the households. But in figure 1, we see that the percentage of households that reported economic crisis in the past 12 months due to a major illness or hospitalization was compared across the intervention group in pink and the control group in red over 3 measurement times. There was a significant intervention by time interaction, indicating that the intervention and control groups changed differently over time. This intervention effect is in the direction that we hypothesized. Control group economic crises increased significantly from baseline to 18 months and then dropped slightly at 36 months. In the intervention group, economic crises decreased steadily. If you think about absolute change, it would suggest that without intervention, there was a 12.6 increase in economic crises, and with intervention, there was a 14.6 decrease in economic crises. Figure 2 displays the percentage of households that reported economic crisis due to environmental disaster like drought. While a greater number of the intervention group reported economic crises at baseline compared to the control group, we see that the rate of decrease in the intervention group was statistically significant over time compared to a lack of change in the control group. So without intervention, there was no change in economic crises during the 3 years. With intervention, there was a significant decrease in economic crises due to things like drought. Figure 3 displays the percentage of households in which adults did Ganyu in response to food shortages. Both groups display an increase in the percentage of adults doing Ganyu from baseline to 18 months, and then they level off. But the control group increased significantly over that time, and the intervention pattern of change was not significant. This intervention effect suggests that the control group adults had significantly higher odds of doing Ganyu than did the intervention group adults. And in this final figure, we see a similar trend related to children's engagement in Ganyu. The percentage of control households in which children did Ganyu significantly increased from 15% at baseline to 27% at 36 months. But the intervention group did not display a pattern of change over the 3 years, staying steady at about 15%. This intervention effect suggests that control group children had significantly higher odds of doing Ganyu than did intervention group children. So, in conclusion, as a result of structural intervention combining sustainable agriculture and microfinance, households were better able to absorb two kinds of shocks, health shocks and climate shocks, without falling further into poverty. And they were less likely than control households to respond to emergencies by doing Ganyu. They had more opportunities to avoid what the participants called harvesting hunger, which is that vicious cycle of working in other people's fields for survival cash and food, only to leave your own farms neglected. By way of discussion, intervening to improve household resilience to shocks may reduce vulnerability to HIV and other hazards in subsistence environments. Variation in local economic conditions has been shown to shape the spread of HIV by such mechanisms as shock-induced increases in transactional sex. In one study, in fact, researchers found that economic shocks explained up to 20% of variation in HIV prevalence across African countries. Further analysis of our SAGE4Health data is planned to determine specific pathways by which economic shocks are linked to HIV. Our recommendations: integrate food security and microfinance components into HIV prevention and treatment to address the structural inequalities driving the pandemic in subsistence environments. Collaborate across sectors to understand health impacts of economic development by leveraging NGO on-the-ground capabilities and academics' research expertise. And consider creative models for evaluating interventions done by economic development organizations, because randomized controlled trials may not always be the most feasible and appropriate designs. I want to say zikomo, and thank you for your attention.